I have a confession I need to make. Hello, welcome back to my channel. If you're new, welcome. Click up there to subscribe. Hit the bell to sign up for notifications. And then when you click the link directly in the box below, I can send you a copy of my free book. This mystery confession, what's it about? We decided to go on this big backpacking trip. Drove for about a day. We went to the far west coast of Vancouver Island. We hopped into a float plane. Took us to a far, even more isolated island on British Columbia's west coast called Nootka Island. An awesome hike, a beautiful part of the world to visit. The thing is, I had a bit of an issue like the day before we were about to fly in that float plane. Our tooth out there's a problem. Take a sip of my warm tea and like, I this big like zing. I'll drink some cold water. Like immediately after, zing. I'm pretty confident I've got a tooth root abscess based on multiple teeth having abscesses in the past. So I know what's going on in my prior visit to the dentist. So I'm miles from a dentist, miles from any type of healthcare. I gotta figure it out myself for the next week. So I need pain relief. I need some type of antibacterial. In my handy dandy first aid kit, I have this guy, the CBD. Starting the CBD, like it's good. It kind of takes the edge off. Seems okay, kind of dulls it. This guy, Allison aged garlic extract. This also happens to be all part of my first aid kit. Natural antibacterial. I'm like, okay, I'm going for the natural thing. Suggested dose for people, 2 tablets twice a day. But here's the thing, we're into like 48 hours later and it's not that it's not getting better, it's getting worse. Like it is just throbbing. I'm lying in bed, I'm trying to go to sleep, and what do I feel like? This like throb, throb, throb. I can't even, I'm having a hard time going to sleep. So I'm like, okay, this natural thing isn't working out. At least in this moment in time is what I'm thinking. Here we are in like the far west coast of BC. We're miles from anywhere where there's no internet, which is great by the way. And like there's no way to contact anybody. Like it's just us, the wolves, the bears, the ocean, the fresh clean air, and like my throbbing tooth. So my confession, what did I do? I'm like, it also happens as part of my first aid kit. I have these guys, antibiotics from some dog gone past, seem to keep a bunch of things. Amoxil 500, like okay, it's been a couple days, pretty confident I have a tooth root abscess. Last time I had one, when I actually had anything scripted out, it was Amoxil. Like time to break out the Amoxil 500 milligram tablets, start taking these. Number 2, I'm like, you know what? Okay, my tooth is throbbing so much. Like the CBD was kind of dulling it, but it was still like this intense, painful throb. I'm like, I brought out this, the ibuprofen. I was fortunately able to sleep that night once that ibuprofen kicked in, as well as using the CBD. Like finally, I started on the Amoxil. Another 24 hours later. Finally, I could actually have a glass of cool water, not have this throbbing tooth, have a glass of, a cup of warm hot coffee, not have the throbbing tooth. So finally I could see that it was treating the infection. Maybe I should have stuck it out a little bit longer with the Allison, that aged garlic extract. Maybe I should have stuck it out longer with just using the CBD versus using the ibuprofen. So I guess what I'm trying to say is that clearly there is a time and a place for conventional medication. There's times when it's okay to use like amoxicillin. Maybe you're using the painkiller, Metacam, Meloxicam, as opposed to the CBD. I mean, clearly there's a time and a place, for the conventional antibacterials, obviously the conventional painkillers. I'm kind of thinking the tooth root thing going on in my mouth, that was probably the time and the place. But that doesn't mean I'm like, struggling with it because I'm the one who's sharing like the benefits and all the array of different holistic options, to help treat your dogs and your cats. And here I am like what? Taking, ibuprofen and amoxicillin? But I'm also one who does advocate for a bit of a balanced approach, to caring for your dog or your cat. So you're not just throwing all of conventional veterinary medicine out, clearly not. Or if your dog breaks your leg, clearly get your dog's leg fixed, which requires like conventional anesthesia and surgery and post-op antibiotics and post-op pain care. But there are so many other instances where we're looking at less serious, more chronic illnesses, for instance, or chronic disease, and no one's seriously looked into some of the holistic options. And therein, I think, lies the big benefits of you guys watching these videos, getting yourself better educated on what all the holistic options are. Oh, there's my big confession. Probably not really worthy of a soap opera confession, but like, gasp, yes. I took amoxil. Thanks so much for watching this edition of Veterinary Secrets of my confessional drug video. Click up there to subscribe, hit the bell to sign up for notifications, and then when you click the link directly in the box below, I can send you a copy of my free book.